Hi everyone, this is Andrea. I just decided to do a voice recording of everything from the Zoom to make sure those of you that weren't able to attend get all the same content, and for those of you that were able to attend have a way to kind of go back and review. So it was just easiest for me to throw it into this format, so I'll kind of walk you through everything as we go. The honor lock system, for those of you that have not completed the practice exam, that has to be done before you can take your exam on Wednesday. So I'll be reaching out. There's a few students that haven't completed that. You will be able to use one piece of scratch paper during that exam and something to write with. And you'll show your blank piece of scratch paper to the camera prior to the exam starting. Your start time won't begin until you've done all your initial authentications and things like that. And then Debbie and I decided we added 5 minutes to all exam times just in case you have slow internet connections and things like that. So the first thing we're going to do is go over the homework assignments. I'll also be posting a separate video where I solve the ABG problems just so that you can see how those are worked out. So I'll do that as well. So the first homework assignment was the chapter 6 assignment where we talk about dehydration and fluid overload. In your textbook, there's actually, it's box 6-1 is really helpful in telling you kind of fluid imbalances, especially dehydration, what you'll see in your clients. So the first question lists the signs and symptoms of dehydration. So the signs and symptoms of dehydration that we will see upon assessment is usually our clients are pretty thirsty. They may have a rapid, weak pulse. When we're dehydrated, our pulse will increase. So it'll be higher, and in some cases it's greater than 100. And because our heart is trying to work so hard to pump additional volume throughout our body that it doesn't have. We will see low blood pressure, dry skin, dry mucous membranes, poor skin turgor, increased temperature, decreased urine output. The urine will also look more concentrated, constipation, and weight loss. So those are all things that we can see with dehydration. Number 2 said list nursing interventions for deficient fluid volume. So if somebody's dehydrated and has deficient fluid volume, we really need to make sure that we monitor daily weights. We need to monitor our I's and O's very accurately. You may hear strict I's and O's when you're in clinicals. Increase fluid intake and encourage oral fluids. Treat any underlying causes. So if we know the reasons why our client's dehydrated. And use caution with elderly patients when we're rehydrating them. So a lot of times our rates have to go slower on our IV pumps, especially if they have any cardiac issues, congestive heart failure, things like that. And remembering that minimum of 30 mLs per day, 30 mLs per hour for urinary output. Number 3 lists the signs and symptoms of fluid excess. So if someone's in fluid overload, we'll usually feel a bounding pulse, elevated blood pressure, respiratory changes, edema, increased urine output, weight gain, and heart failure. So weight gain is a really good indicator to us about fluid overload, especially for somebody that has CHF. So we're going to do daily weights in the hospital settings. If we see any weight gain of over 2 pounds in one day, then that really alarms us of potential fluid overload. Fluid overload can happen because someone's heart doesn't pump effectively. It can happen because it's an elderly client and we keep them on IV fluids too long and they almost get overhydrated, things like that. We also will likely hear crackles in the lungs, that peripheral edema. Number 4 lists nursing interventions for excess fluid volume. So we're going to monitor weight and fluid output. We might place our patient in a Fowler's position or a position where it's easier to breathe, because when there's too much fluid on board, it is difficult for individuals to breathe, and they usually take shallow respirations. We're going to administer oxygen if needed, any diuretics as needed, fluid and sodium restrictions. So that's the kind of run through on the class activity. I'll do the ABGs as a separate video insert. So now let's go to the ticket to class for the cardiogenic shock case study. And I know this was a little bit more challenging, kind of made you think outside the box a little bit as far as what would you do as a nurse. The key components is to really look at the case study. So what's the information that we were given ahead of time? And the big thing in this piece is that this client had a myocardial infarction or a heart attack 2 days ago. So when we're talking about cardiogenic shock, these clients usually have that acute history of heart problems, okay? Pain's 10 out of 10. If we look at those vital signs, blood pressure is low, pulse is elevated, O2 saturations are low. They have crackles, irregular and rapid heartbeat. They're restless and apprehensive. That restless and apprehensive usually comes from the low oxygen saturations. So kind of any of your clients that suddenly become more anxious, restless, apprehensive, making sure you're checking those saturation levels. Number 1, name 3 priorities for Mr. Hall's care. So when we talked on the Zoom, students said ABGs, which is great. So airway, breathing, circulation. So airway, we want to make sure that we restore his oxygen. So we would apply oxygen to try to get the saturations to improve. We would also potentially think about positioning. We hear crackles, so we want to make sure that our client's in a position that promotes good breathing and good oxygen exchange. We also, priority-wise, we want to control his pain. So a lot of times in these situations, we give IV morphine pushes, but making sure we help control his pain. And also reestablish circulation. So he may be given medications to help increase his blood pressure, such as dopamine, dobutamine. Those are some of the medications that are used. Number 2, with which members of the healthcare team does the nurse anticipate collaborating? This comes from you. So there's no magic place to find this answer, but if you were in the room with this patient, who would you expect to call to help? So we'd probably call the healthcare provider. Respiratory therapy would be helpful to us, and a cardiologist if our hospital has that available or if we'd have to transfer our client. Number 3, are IV fluids appropriate right now for Mr. Hall? And they're not. They're not appropriate. This client likely has pulmonary edema. And if we give additional fluid at this time, then we could put our client in fluid overload. So even though that blood pressure is low, we're going to use medications to get that blood pressure back up. That just doesn't mean we're not going to give our client any fluids, but right now they probably do best with oral fluids and not IV fluids until things like the crackles and those types of signs are gone. Number 4, what signs and symptoms indicate Mr. Hall is in cardiogenic shock? He had a recent MI, myocardial infarction, that's really important. He has pulmonary edema that's showing up as crackles, and he has decreased cardiac output, so his blood pressure is 96/40. So that was the cardiogenic shock case study. We usually do that in class as small groups. The exam is not as focused on cardiogenic shock, so this kind of helps take the place of that, but you still definitely need to be familiar with cardiogenic shock. Okay, let's see, switching gears. So now we're going to do a little review to help get you ready for the exam. So the exam is only 30 questions, which is always a little challenging because this is really good information. But as you prepare for exams in Nursing Care of Adults 1, realize that there's a big shift in application and interventions in your nursing role. So in simple terms, instead of saying memorize these definitions or memorize these normal lab values and just tell me what the normal lab value is, it's application. So you have to think about scenarios. You have to think about patient scenarios, and then the questions a lot of time are looking at what your nursing judgment would be. What would you do? What would you do first? What wouldn't you do? Those types of things. So I'll talk about that a little bit more as we go through this short review, but just to kind of get you ready for the exam, there are 4 acid-based questions that you will use your scratch paper to solve. I highly encourage you to memorize all of your normal lab values. Make sure you write those down on your scratch paper once you begin your exam. So the proctor knows that once you hit start, then you could write down anything that you can recall that you normally would have wrote down on the top of your test. So those will be on there as well. You are not responsible for partially compensated, fully compensated. We don't handle that in this class. What you're going to do instead is just the straight, is it respiratory acidosis or alkalosis, or is it metabolic acidosis alkalosis? Okay. So let's go through a little review here just to kind of talk about some topics in addition to the lectures. So make sure you've listened to the lectures multiple times. Make sure you've read your chapters. Really do your best to prepare for this exam. When I talk about you need to know normal lab values by memory, not only for this test, but for your role as a nurse. Because, for example, potassium is normally serum potassium 3.5 to 5. And if you are getting a report and the nurse giving you a report says your client's potassium was 2.1, instead of thinking, oh, I should go look this up, I wonder if that's high or low, you need to immediately know that that's low and all of the complications that could arise in your client because of that. You should immediately know that's low, and you'd start asking the nurse giving you a report, okay, what was given? Was any oral potassium given? Was any IV potassium given? Has the client had any chest pain? You know, all those types of things. So really important that you know these normal values for your nursing role. All right, so let's just review a couple things, just a couple points that I wanted to capture out of the lectures. So respiratory acidosis, so you learned how to solve those problems, but realizing this is the most common acid-base imbalance that you're probably going to see when you're in practice, okay? ABGs are drawn from arterial, vasculature vessels. Those are done by specialists in lab or respiratory therapy that are trained. A lot of times in critical access hospitals, we don't get to see ABG values because our clients aren't sick enough and they're sent to higher levels of care where those values are drawn. So this may seem like it's harder to relate to because you may not have seen this in clinical, but rest assured it'll make more sense with practice. So respiratory acidosis, we see this a lot in our clients that we take care of. Anybody that has COPD, emphysema, difficulty breathing, where they retain a lot of carbon dioxide, they don't blow it back off, these clients are in respiratory acidosis. So if they have really shallow respirations, if they have underlying lung conditions, they may be in this state almost all the time. Any respiratory diseases. Also people that have a lot of pain medication or sedatives on board. These clients are also in respiratory acidosis because they're just doing that shallow breathing, not blowing off adequate amounts of CO2. Something to think about as well. Anaphylactic shock, we talked about in the lecture. Anaphylactic shock, thinking about some of the signs and symptoms we might see, what meds we might give. Anaphylactic shock, remember this is a fast reaction, an adverse reaction that a client can have to anything that they have an allergic sensitivity to. So for some people it could be a medication. For others it could be eating things like peanuts. For other people it could be an exposure if they have an anaphylactic response to some sort of perfume or cigarette smoke or something like that. So a lot of times with anaphylactic shock, we'll see urticaria, which is hives, and those are kind of kind of be all over the body. What's different about anaphylactic shock versus other shocks is our clients get laryngeal edema. So they get that swelling of their airway, and it makes it where they feel like they can't breathe, and they also have the risk to lose their airway completely. So this is a very, very serious type of shock that needs immediate nursing intervention. So really important that we know what to do for these clients. It can cause bronchospasms. It can cause anxiety, especially think of if you feel like you are losing your airway, that's going to make you incredibly anxious. Medications that are given, just remembering from our lecture, we give epinephrine and we give diphenhydramine, and diphenhydramine is trade name is Benadryl, and that's going to help with decreasing that inflammation in the airway and throughout the body. So airway is always our biggest priority with anaphylactic shock. Think about with anaphylactic shock, you never know when it's coming. So we might know that somebody's allergic to bees, they got stung by a bee and they go into anaphylactic shock and they use their EpiPen. But clients can go into anaphylactic shock if they have an allergy to a medication that we're giving them that they've never had before. So you realize as a nurse, if you're giving your client something they've never taken before, always keep that in the back of your mind. Always, that extra check-in on them, make sure things are going okay. It doesn't hurt because we don't know when these things could happen. Early shock. So what are some of the signs and symptoms if a client's in early stages of shock? One of the first things that'll happen is tachycardia. So we tend to notice that first. Their pulse is elevated, but we don't know why. Can be an indicator that shock is going to happen. Remember when we talked about that MAP in lecture, that mean arterial pressure needs to be greater than 60 to make sure we have coronary artery perfusion. They might start to have a little bit of decreased urine output, pale and cool skin. They may be a little anxious, increased rate and depth of respirations. Those are all things that can happen early on in shock, and usually noticing that tachycardia as our first sign. Osmolarity we talked about in lecture. So we talked about isotonic, hypotonic, hypertonic solutions. Remember that isotonic solutions aren't going to pull or cause any fluid shift. They're just going to rehydrate. So things such as 0.9 NaCl or sodium chloride, lactated ringers. Hypotonic are going to pull the solutions back make that fluid shift go back into the cell. So that's going to be your half normal saline or your 0.45% NaCl. And then hypertonic solutions have a greater osmolarity than blood, things like 5% dextrose or D5. Great questions about when do we use which fluid, things like that. And I talked about that some in lecture. I also attached a Lippincott resource on this content page for chapter 6 on the very bottom that gives a really thorough explanation of when you would use which solution. It's a little more in depth than what you're definitely responsible for in this level of the program, but I think it's helpful for those of you that just want to know more, and it makes more sense to you when you know more. So that's there for you as a resource. A lot of times dextrose is added, or the 5% dextrose D5 is added to, given to clients in their IV bags when they're NPO. So when they have no sugars that they'd be getting from their meals, or if they're very malnourished, or if they are diabetic that's trending down on like an insulin drip. So that's kind of a little history with that. Chvostek sign and Trousseau's sign. So what does the patient experience? What electrolyte imbalances cause these? I talked about it in lecture, but just wanted to remind you, make sure that you look at the videos of what the clients experience with this, and know that when we have low calcium levels, low magnesium levels, these things can happen. So make sure that you took the time to watch those videos and know what signs and symptoms you're looking for. What are some of the signs and symptoms of dehydration? How do we assess dehydration? Again, referring back to the chapter 6 assignment that we did, this is going to be part of your everyday nursing job, is assessing for dehydration in your clients or fluid overload. And this is something you're going to see all the time, dehydrated patients or patients that have too much fluid on board. So making sure that you really understand your assessment. On our elderly, remembering that when we're doing skin turgor, the hand is no longer a valid assessment tool for skin tenting because the hand has lost that elasticity. So instead, we use the forehead or the sternum on our elderly patients when we're checking for skin turgor and watching for the tenting of the skin that bounces right back, that doesn't have a delayed response. Fluid volume excess, same thing, referring back to the worksheet we talked about, the boxes in your book that are excellent, signs and symptoms, causes of that. Really important for you to be able to have that knowledge as a nurse. We talked about in lecture dopamine. So this is a medication that's given, it's a vasopressor. So it's going to increase the force of cardiac contraction, and that's going to help increase blood perfusion to the kidneys. So this is given a lot with cardiogenic shock. It's going to help constrict blood vessels, peripheral blood vessels, to get that blood flow back to the core, back to the vital organs. So a lot of times when we assess a patient after they've received dopamine, they get a really bad headache from it, and they tend to have peripheral pulses that are a lot more weak or faint because of that vasoconstriction that happens at the peripheral level. So we would expect that. Priority nursing interventions. So if your client were to have things like low blood pressure, what would you do? Okay, would you run and get the charge nurse? Would you run and call the doctor? Eventually, but what could you do right away in the room? So if somebody has low blood pressure, a lot of times they're going to get dizzy and lightheaded. So making sure positionally we put them in a position, whether they're lying flat. In severe cases, you could even, put them in Trendelenburg position with their head lower to get blood perfusion to their brain if they weren't responding to you. But you want to make sure they're flat and they're safe, their side rails are up, so that they don't pass out. If somebody has any bleeding, so we know that hypovolemic shock can happen because of bleeding. We worry about bleeding a lot after surgeries. So if somebody has an incisional site that starts bleeding, as nurses, we need to try to stop the bleeding. Okay, so same thing, like if we took out a client's IV site and the site kept bleeding after we took the IV out, we would hold pressure until that bleeding stopped. We do the same for an incisional site that started bleeding. A lot of times bleeding can happen when patients change positions, so kind of be aware of that. Making sure if you're trying to stop bleeding, obviously you're going to put gloves on, try to use some sort of sterile bandage, whether it's an ABD pad or something to stop the bleeding. In severe cases, you may just have to use whatever you can find in the room to put between your gloved hand and your patient to hold pressure to stop that bleeding. And then, in those situations, you could call from the room to say, hey, I need help down here, get somebody to notify the charge nurse, provider, things like that. But always think about, don't run from your patients when there's trouble. Try to help them. Try to do what you can first to make those interventions happen. Same thing if they're short of breath. If they're short of breath, we're going to elevate their head of the bed. If you walk into a room and somebody's short of breath, you're immediately going to put their head up in the bed. Because that's going to help them breathe and apply oxygen. So those are all things you can do now, which sometimes is hard as you take that transition from CNA to nursing student and future licensed nurse. So just thinking about all those things. In Nursing Care of Adults 1, a lot of the questions are applications. So it gives you a lot of background information and you're applying everything that you know. One thing that I think is helpful for students when it talks about questions ask you about priorities, what would you do first, or what wouldn't you do, or those types of things. Put yourself in that actual situation. Think of yourself in a patient's room and this is happening. What would you do? Would you apply oxygen or would you run down to call the provider? Well, you'd probably apply the oxygen first. So, start thinking about yourself in these situations, and that can be helpful. So that kind of concludes just picking out some topics that I wanted to go over from the lecture. Again, please reach out to me if you're struggling, if you need any additional help. We can set up a Zoom meeting, we can email back and forth. I'm going to go ahead and do an ABG video next just to show you how to solve those problems to make sure any questions are answered there. All right, thank you for listening.